started. It is 5:30. So I'll go ahead and introduce this entire webinar by saying this is the Advocacy Q&A hosted by Project Lyme. We have 4 great guests with us today. The goal of this event was really coalition building, and you can tell just by the 4 really well-rounded advocates that we have on this panel, that I would say that we are definitely working for today. The goal of this event was really coalition building, and you can tell just by the 4 really well-rounded advocates that we have on this panel, that I would say that we are definitely working today. All right, I apologize. I just had some audio issues there. I'm not sure if everybody heard me cut out, but I think we're back on track. So as I mentioned, coalition building, we have a bunch of great experts together to teach how to become an advocate on an individual, state, federal, and how to turn that into coalition building, which again is really the underlying goal of this event. So, about our panelists, we have Dorothy Leland first. I'll go ahead and introduce her, and she's going to be presenting first as well. She is the communications director and vice president of LymeDisease.org, the largest Lyme disease communications network in the nation. She'll touch on a variety of other things that they do as an organization, but she does write a blog called Touched by Lyme and was the co-author of the book, When Your Child Has Lyme Disease, Parent Survival Guide. So she's definitely very knowledgeable in the space, especially from how do you convey and advocate on behalf of yourself and maybe somebody else like her child. We also have Bonnie Crater, who is the co-founder of Center for Lyme Action, a 501c4, which Project Lyme is a founding charter member. Best known for the annual Lyme Fly-In, Center for Lyme Action organizes a variety of events aimed at bringing together advocates and legislators to discuss patient issues. And Bonnie is definitely going to dig deeper into how you can get involved with those things over our event this evening. We also have Holiday Gaudreau, who is the executive director of Live Lyme Foundation, co-creator the free global app Tick Tracker, and she currently serves as co-chair for the Tick-Borne Disease Working Group. Serving in these variety of positions, she's in a unique opportunity to effectively communicate the wants and needs of patients directly to the federal government, though I will say she will likely have a disclaimer before she gets started speaking this evening. Lastly, we have Michelle Tressler, who was a late addition to this panel. She co-founded the Massachusetts Lyme Coalition and authored the final version of the Lyme Patient Protection Bill that now protects 80,000 residents each year in Massachusetts. She's going to be educating, how do you take that model and potentially apply it to other passing laws in other states, and really discussing the underlying beneficial impact of coalition building and working together across platforms and across levels of engagement. So I'll go ahead and turn it over to Dorothy now, who's going to spend some time introducing us to more about how you can become an individual advocate and how LymeDisease.org offers those opportunities for people.
Okay, thank you. So did you share your screen with me so I can?
Yeah, I can definitely go ahead and share your PowerPoint.
Okay, just a second here. Yeah, so I've long said that Lyme disease is a DIY or do-it-yourself illness, because many people have to figure out on their own what's wrong with them, figure out on their own how to get to a doctor, figure out on their own how to do anything that they need to do. And so at some point we want to go beyond do it yourself and how we can, as Noah said, build coalitions to get things done on a larger stage. But it's also important to do things on an individual basis. So for some reason this isn't changing. There it goes. It was late. It was lagging behind. One of the first things that you have in terms of individual advocacy is your own personal story. and people have things in common with each other, and they have things that are just sort of their own. Without going into deep detail, I'll say that my story is that I'm the mother of a daughter who's 17 years ago, she was 13, became severely disabled practically overnight for no obvious reason. And we went to lots of doctors, and she got lots of tests and images and everything else. And basically they couldn't find anything wrong with her. And so that's when we as a family had to really dive deep and figure out that actually what was going on was Lyme disease. And ultimately we figured out Bartonella, and get to a doctor that could help us. And so when I advocate first as the mother of a child that was suffering. And when you have your personal story, I was, you think, who can you advocate to? Who can you tell your personal story to? And it starts out with people that you know and people that you're connected with. I'm now introduced sometimes in my neighborhood as people that, oh, and this is our local Lyme expert. But and I never say that I'm an expert, but other people sometimes say that. And so there are people who, they talk to people at their church, they talk to people at their kids' schools, and sometimes it's word of mouth. Sometimes soon you'll be giving presentations. I know a mom who, started by talking to the teacher at school and ended up giving presentations to the PTA and, various other things about Lyme education. And when I got involved in this stuff, social media didn't exist, but now that's a thing that is, that is a big part of our lives and a way to spread things. And then there's ways of extending your reach. And so again, I'm trying to change it to the next one, and it is not happening. Nope, it went away.
Dorothy, real quick, I wanted to say when I'm sharing my screen, you cannot click the slides forward. So if you share yours, you'll be able to control it.
Oh, okay. So,
I'm happy to if you want to just say like next slide.
Well, I made some changes from what you have. So okay. Let me see what I can do here. That wasn't what I wanted. Well, phooey. Let's see. So screen sharing has stopped. Okay. So have you given me the opportunity to do it?
Yep.
Yes.
Yep.
Here we are. Sorry about that. So I was going to just click on to, well, it's still not, okay, that one. Let's see if we can go to this one. Okay. So these are just some samples of things that happen to be available on our website. The two at the top were brand new, the Neuro-Lyme, Cardio-Lyme. I did a blog just today about a mother and daughter who, looking for a way to advocate, have created all of these things, and you can download them and get them made into a magnet and put it on your car. And so these are, if you go to my blog from today, there's a whole bunch of different things that you can download. The ones across the bottom are just examples of information sheets that we also have on our website that you can download and get printed. And so sometimes people are doing a booth or, talking to a group of scouts or whatever. And if you want to have information, those are some things that you can do. A larger thing that we do is that the My Lyme Data Project is something where individuals can really make a difference that gets amplified. And so My Lyme Data is a program where it's a patient registry program where people go in and give their information about how long they've been sick, what treatments they've done, what helped, what didn't help, all kinds of information. And this is used, it's all de-identified registry, so information, so you're not telling your personal story, but it's this many people had a particular outcome. And there's a lot of important information that has come out of the program so far. It started in 2015, and there have been journal articles that have been written based on this information, and researchers who have used it to inform how they set up, research projects and that kind of thing. They also, more than 60 references to Lyme data were in the last tick-borne disease working group report to Congress, because it is a place where there's information about Lyme patients where that hasn't existed before. And we came out with a chart book a couple of years ago that was updated, which was summarizing the information that we had at that point. You can go on our website and you can download a copy of that, and that's also useful for for any advocacy you might get involved in. And so there are other opportunities for individual action, such as local support groups, various ways of contacting your legislators, signing petitions, letters to the editor, public comments to different groups. You can write a guest blog for LymeDisease.org. So anyway, we'll be talking about that kind of stuff today, I think. And then also in terms of Lyme education, it's important that to stay current with what's happening. One way to do that is we have a weekly email newsletter. NOAA sends one out. I think pretty much all the groups do. That's a good way to get, I just got yours today. That's a good way to keep informed about what's happening. And of course, we have a Facebook page, Twitter, and Instagram, as do a lot of the groups. And those are good ways to get to get information too. So that was just my quick overview. And so there you go.
Awesome. Thank you so much, Dorothy. You hit the nail right on the head in terms of the opportunities that are available for people to get involved, especially on an individual level. A lot of the nonprofits that are on this call specifically really offer a lot of opportunities. So as Dorothy mentioned, we encourage you to hit up their websites. That's LymeDisease.org, ProjectLyme.org, the LymeFoundation.org, Center for Lyme Action.org, to learn more about how you can get involved on a direct basis. But I'm going to go ahead and turn it over to Bonnie now, who's going to speak a bit more on the Lyme Fly-In and ways you can get involved there.
Great, thank you, Noah. And thank you so much for having this event. It's terrific. I'm a great admirer of all the people on this call, and thanks to Project Lyme for organizing this webinar so that we can communicate how folks can get involved with Lyme advocacy. So I'm Bonnie Crater. I'm with Center for Lyme Action. We are a 501c4. That's a special type of nonprofit that's focused on unlimited lobbying for the federal government. Our mission is very simple. We are focused on growing federal funding for Lyme disease. Our strategy is also pretty straightforward. We are using tried and true methods. We hire professional lobbyists to advocate for Lyme disease research and programs in both the legislative and the executive branches. So we have a particular approach to how we're doing our lobbying. First of all, we're bipartisan. We talk to Democrats, we talk to Republicans, we talk to independents. Our friend Kristen Honey says the ticks don't care if you're a Democrat or Republican. So we talk to everybody to try to increase the federal funding for Lyme disease. We try to take an inclusive approach because there's actually quite a few different points of view about Lyme disease. And so we try to take all those points of view into account as we approach our Congress folks. There's a lot of sick people out there. We try to take a humane approach, and we also believe strongly in science, because we believe that science is going to be the thing that helps us get a good diagnostic and a good therapy going for persistent Lyme disease patients. We are a member-funded organization, so I want to give a shout out and thanks to our members. Of course, Project Lyme, who's hosting this webinar today, is one of our charter members. Also, big thanks to Alexandra Cohen, the Barry Lyme Foundation, Lori Woods, and the Fairbairn family, who are also our charter members. If you're interested in becoming a member, there's an individual membership of $30 a year. So just go to centerforlymeaction.org and you can sign up and become our members, or you can just sign up for our newsletter on the website. We have a vision. Our vision is to cure Lyme disease by 2030. We call that the Lyme Moonshot. And we wrote a very detailed policy paper. So if anyone's interested in reading about policies that to cure Lyme by 2030, go to lymemoonshot.org and you can download a 30-page paper and read about all the different ideas that we have about curing Lyme disease and leveraging the federal government for that. We're a very young organization. We've only been in operation for a couple of years, but we've had some really good successes. And this is a team sport, everyone. You know, we really, some of you who are on the call, you've participated in many of our programs, and we really can't do it without you. Signing letters, going to our Flyin, you know, all those things are really, really important. And representation from every state and every district is essential for actually moving the ball forward with the federal government. But I want to talk a little bit about our success. In FY21, we actually nearly doubled the appropriations funding. We went from 55 million to 108 million, which is fantastic. And again, you know, we're organizing, but it's really the Lyme community that's really driving this. So thanks everyone for all of your help on this. There's two types of legislation in the federal government. This is a little bit of legislation 101. One type of legislation is an authorization bill, and that type of bill tells the executive branch what they should be doing about Lyme disease or other things. The other type of bill is an appropriations bill, and that's a funding bill. So that funds whatever the programs are in the executive branch. So Congress is our lever. They approve all the authorization and appropriations bills, and this is how we approach this particular challenge. I want to talk a little bit about where we are with FY22. We have increases for in Lyme disease, both approved both by the House and by the Senate. So I want to just review that really quickly with you. So as of October, there's 24 million that's dedicated to the CDC. This is the biggest appropriation ever for Lyme disease in the CDC. It's 50% above the FY21 number of 16 million. So that's terrific. The congressionally directed medical research program, which many of us are big fans of because it includes the Lyme community for reviewing projects, is also funded at 7 million. And then we have a new program, which we are grateful for the Cohen Foundation co-funding, making a $25 million gift to the federal government for the Limex Innovation Accelerator. And the House has approved $5 million for the government to work on that as well. So that's great. For the Senate, they have slightly different appropriations, $20 million for additional research in NIH's group, NIAID. There's $2 million for the CDC, $10 million for the K-Hagen-Tick Act. So you can see that there's a lot of activity and endorsement of the work that we're doing. The House and the Senate right now are in conference, and so they're discussing all of these appropriations. We expect that things will go probably similarly as last year, where we'll see a signed appropriations bill in December. But we'll see. We really don't know, but probably December. Just a quick thing, the appropriations is on an annual schedule. It starts in February with the president's budget. We expect that to happen this year. There are budget hearings, appropriations committee markups, then there's a vote on the floor, then there's this conference, which we're in the middle of right now. And then the appropriations is signed into law by the president. We have an annual schedule where we do a fly-in. I'll talk about that in a minute. Then we have constituent appropriations requests to both the House and the Senate. Then there's letters and letters and letters. And then hopefully in December, we are celebrating our success. The Flyin is how we kick this off. And we're excited. We hold the Flyin every February. It's actually a pretty fun thing. You get to, we set up meetings for you with your congressperson, and we ask the staff, the congressional staff, or sometimes it's the Congress member or senator to help us cure Lyme disease, and please fund these programs that will help us get there. So I'm pleased to announce that we have set the date. We did this yesterday, so we're excited to announce that we are going to have our virtual Lyme Fly-In on February 22nd and 23rd in 2022. So that's a few months from now. But please put this on your calendar, and it will be virtual. The reason that we do it as virtually is because there are very few face-to-face meetings being scheduled on the Hill. It also allows for many more people to participate. So we did this last year. It was a great success, and we look forward to having you all participate. So mark your calendars and go to our website and sign up for our newsletter, and you'll get a notification to how to actually sign up for the Fly-In February. So with that, I just want to say thanks to Noah, and I'll turn it back over to you.
Awesome. Thank you so much, Bonnie. I'm definitely going to make sure to put that on my calendar. I know I've had a lot of fun the past couple of years participating in the Fly-In, and I'm so glad that you were able to unveil the date on this event. So it all kind of works out very well.
Sure.
Everybody make sure that you look to participate in that. And just to recap a bit on what Bonnie was saying, obviously a lot of the work that Center for Lyme Action does is focused on the federal level. Holiday is also on the federal level, but she's serving as a committee member, which is just another opportunity that individuals have if they want to give a lot more commitment than you may need to on an individual level. You can follow in Holiday's footsteps and try to be on a working group at the federal level. So I'll let her explain a little bit what that is like, and how she goes about her processes every day. Holiday, I'll go ahead and turn it over to you.
All righty, unmuted.
Perfect. Yep.
Okay, let's share the screen. You know what, Noah? I think I might just have you do it. Is that okay?
Yep, I can definitely do that, and just let me know when you want me to jump on through.
Okay, hang on a sec. Okay,
All right.
Yep, we can start. Alrighty, so I am the executive director of the Lipline Foundation that was started by my daughter Olivia when she was 12. She's now 17. And truly, it really all started because she started self-advocating. And so if we're talking about advocating right now, Bonnie talked about it on the federal level. We're going to have Michelle talk about the state level. Dorothy talked about it, the grassroots level. I can say that Live Lyme was really formed from the grassroots level of the fact that Olivia started emailing all of our local representatives here in Colorado and saying, hey, it's May, Lyme Disease Awareness Month. Can I come in and do the Lyme Challenge with you? I think when she was like in 5th grade. And, I kind of said, good luck. Nobody's going to, respond to you. And they all did. And that's kind of what snowballed into the Live Lyme Foundation. And now we give grants to kids and grants to scientists. And obviously we also do education. And just an FYI, our grants for kids are due this Sunday. So if you know of any families that have a child suffering from a tick-borne disease, we ask them to apply. So I think one of the things that I have always said to people always come up to me and they're like, how can we get involved? How can we get involved? And what I always say is, your representatives, your congressmen, your senators, your state congressmen, your mayors, your governors, they all work for you. And you have a right to go and meet with them. So reach out to them, write a letter, call them, ask if you can come in for a meeting. Bonnie and Jeff have done a fabulous job creating Center for Lyme Action. And one of the things, the Lyme community has been struggling for so many years, and we finally got a lobbying group. And you think of the COVID long haulers, that it's like less than 2 years and they already have 2 lobbying groups. So we're kind of behind, but I think we're getting momentum. And so I always tell people, ask them, when the Kay Hagan Tick Act was going on and we were trying to support this, we were sending emails and letters letters and calling and going into the offices saying, hey, have you looked at this Hagen Tick Act? Will you please support it? And I would say to your representatives, you should really be asking them, have you read the Tick-Borne Disease Working Group report 1 and 2? Now, I will state that Noah said, I am speaking on behalf of me and not of the federal government, the U.S. Department of Health and Human Services, or the Tick-Borne Disease Working Group. That being said, I would definitely ask your representatives, have you read the first report? Have you read the second report? And the third report will be coming out in December of 2022. And we need them to read that, because at the end of the day, they're the ones who decide how much money goes to CDC, NIH, all of these different groups. So regarding the Tick-Borne Disease Working Group, and we can change, Noah, sorry, I'm just like carrying on here. So here's our grants. So, and then here's Sue Collins. So this is Olivia, like literally going through the halls at the Senate and Congress, and like going and knocking on doors and like leaving brochures, leaving information about Lyme disease. And I know with COVID, it might be tricky right now, but once things get better, you are allowed to go and walk the halls. So I always say, if you're in DC, go spend an afternoon, go see your representatives and go walk the halls. And you'd be surprised if you just show up, how many people be like, yeah, let's talk to you, or an aide talks to you, or someone like that. So, okay, we can go to the next one. Again, what Bonnie, let's go back one. What Bonnie was talking about, the Center for Lyme Action, the Fly-Ins, they're fabulous, they're great. It really is getting the word out, to have these scarves that Bonnie and Center for Lyme Action got. So you could see everyone who was walking around, advocating for tick-borne diseases. Again, Bonnie talked about Limex, which is so fabulous that we have a private public partnership with the Cohen Foundation and HHS. And, they have $25 million in what they modeled it after the Kidney Acts. And what they're really working for is they're going to do a big technology push to find better testing and put it out there with a cash prize at the end of millions and millions of dollars, and trying to help get that then approved by the FDA. So if anyone knows anyone who wants to get into this Limex, please go to the HHS website to learn more, because it really is going to be fabulous that we'll have this large chunk of money to give to researchers who can hopefully find and create a test that is accurate, reliable, cheap, and available to everyone. So that is Limex. We can go to next slide. Maybe. Uh-oh.
Give me 1 second. It always
Sure.
takes away the ability to move it like halfway through.
So the Tick-Borne Disease Working Group, they've had 2 fabulous last groups that started, it was 2018, 2020. They wrote unbelievable reports. If you haven't read them, I highly recommend you do. It is fascinating, and they're super detailed, and everyone working on it did a really great job. Dr. Linden, who and I are the co-chairs for this last one. And our whole goal is really sort of to button up what the first 2 groups did, not go back and sort of regurgitate and kind of get into all of it, but really take the high points and what we think Congress would fund. And so we've really looked at 6 areas of better testing, better therapeutics, better education, helping patients, helping doctors, helping scientists, to really fund and hope that Congress will look and say, well, why don't they have good tests? That's crazy. Why don't they have good therapeutics? Why isn't the insurance company paying for this? And we really want to have it buttoned up and have it just in kind of just bullet points, because what we know is Congress only has probably like 3 minutes to look at something the aide's gone through and kind of look and say, hey, do I want to get involved in this or not? So instead of having a huge, ginormous report, which we will have, we're going to button it up with just like 10 points of what is most important from these last 3 years and what we feel that Congress will fund, you know, of easy stuff, of people that might not understand what's going on in the tick community, but a simple thing of like, so why do they not have a reliable test? Like, that's crazy. So we're just in the middle of subcommittee meetings now, and the subcommittees have to get the reports to the main tick-borne disease working group by the middle of February. We are hoping to have an in-person meeting. The date is to be announced in DC for the tick-borne disease working group. It probably will be decided in January, depending on what the federal government's doing, because as of right now, they're not having meetings. But one of the things I tell people, and Noah, we could switch to the next slide, is how you can get involved with the tick-borne disease working group is that you can write a public statement 24 hours, 7 days a week. And here is the website. It's tick-borne disease at hhs.gov. And Dr. Linden, Hu and I are actually the chairs of the public comments committee, and we will be reviewing every single public comment that comes in. So we really will be hearing you. And as a mom of a kid who's been sick for 10 and a half years, like, I really do want to hear from the patients, the advocates, the caregivers of like, what is important to you? Because I know as a mom what's important to me, but we need to hear from you guys. So please, I know there's a lot of Lyme groups on here. Please pass this out. And we really do want to hear your feedback and suggestions, because we really will look at it and say, okay, this is what the public wants. Like, we really need to help them get what they want. So please know 24 hours a day, 7 days a week, you can send your input, feedback, suggestions to the tick-borne disease working group. Okay, next slide. And so what I would say to everyone is get involved. Get involved on your local level, get involved on your state level, get involved at the federal level. Because the only way we're going to push this needle forward is if we all come together and move the needle forward. So, you know, I thank Dorothy for everything she's doing. Bonnie's doing a fabulous job. And we really did need a lobbying group. I mean, we need it. And I can't wait to hear what Michelle has to say about the state. So I just thank you, Noah and Project Lyme, for having us on. It's a great way to get out. And, you know, just whoever's on, please know you can email me anytime at holiday@livelymefoundation.org if you have any questions or comments. And please definitely send stuff off to the tick-borne disease working group. Thanks.
Awesome. Thank you so much, Holiday, and really appreciate your commitment to working in that group. I will say to everybody on here, I will be sharing that email address that she just showcased where you can submit public comments. I'll do that tomorrow when I send around the YouTube video for people who may be having any audio issues or things like that. So now we're going to go ahead and turn over to a brief Q&A session before we introduce Michelle's short presentation on building coalitions and passing legislation. But since Michelle has been sitting there without an opportunity to speak for the time so far, I wanted to go ahead and start with questions towards her, which is, you know, we're going to be speaking on how do you work through an advocacy roadmap. And first, I wanted to start with Michelle to say, how do you personally identify a target audience? And then I'm going to go ahead and bring that question around to everybody else as well.
So I think my presentation will probably cover that really well, but just briefly, how to identify a target audience is first you need to identify what your problem is, then your potential solution, and then who can help you along the way, right? So key stakeholders, as well as who it impacts and who you need to contact in order to make that solution happen. So in terms of state legislation, we're looking at, you know, really galvanizing the community and everybody who's affected by Lyme. And then we're looking at working with legislators and really increasing the communication between people and their legislators. And yeah, that's basically it. And then I guess I should say beyond that, actually, is what's interesting about the state level is with HIV, AIDS, and breast cancer, they went state by state to get certain objectives done because they didn't have the support on the federal level for some things, such as mandating health insurance coverage. So what we did in Massachusetts wasn't reinventing the wheel. We were just taking a page out of their playbook, and it's something you can do too. And I can't wait to tell you about that.
Awesome. So excited to definitely dig a little bit deeper into there. I want to go ahead and swing it over to Bonnie actually, because I think you'll be able to provide a great comment as to how do you identify your target audience specifically with Center for Lyme Action.
Yeah, so for Center for Lyme Action, our target audience is Congress. And the reason is that Congress is in charge of appropriations, authorization bills, appropriations bills. They tell the executive branch what to do. So we don't call the CDC up directly. No, we call our Congress representatives. We call our senators. We call our local representatives in the House, and work to influence them to pass bills, authorization bills and appropriations bills to move the needle forward.
Awesome. And swinging that over to Dorothy, I think your presentation did dig into it a little bit, but how do you as an individual identify that target audience, and how is that different from, as Bonnie mentioned, that Center for Lyme Action is targeting Congress specifically? Gonna need you to unmute real quick.
Unmute. All right.
Perfect.
Figure it out eventually. Somebody made a reference to breast cancer. And, I remember a time when breast cancer wasn't mentioned in polite society. And that really, so a big part of their getting to the point where they could make the policy changes that they needed was raising awareness of it, educating the public, having people form those words without, getting embarrassed. And so I think a really important part of this, which supports what Bonnie and everybody else is talking about, is just raising the public profile, so more people know about Lyme disease, more people, and I've been involved in this kind of thing for about 15 years. And there have been so many articles in national publications about Lyme disease lately that listen to the patient's point of view. When in the early days, first of all, it was hardly ever even mentioned. And then there were, they would go and they would talk to a couple of, doctors, and then, representatives of the IDSA. And then they'd go and they'd maybe get something from a patient, but it was just kind of like, oh, those poor patients that just, they just don't know anything. So I would say that has really changed in the last 15 years. And some of the things that I mentioned, social media and a lot of that stuff has all been part of it. So in terms of target audience, it can be, as I said in the beginning, talking to people in your own network, talking to people at your kids' school, talking to people at your church, talking to your neighbors, talking to the Rotary Club. And so it really, it's happening on a lot of different levels, but people, even the lady with the magnet on her car, Lyme awareness magnets on her car, who knows how many people see that? And it's just, it's wonder what that is. So I think that part of the target audience is sort of what's within your bailiwick. Who are the people that you talk to? Who are the people that you have any sway with? And then obviously you step that up to take part in the fly-in and talk to your legislator and that kind of thing. But when they talk to the legislator, that's your local representative. And so he or she wants us to know what's happening in your community. And if you can say, this was going on at the local school or this or that, they actually do care about that. And so it really is, to my view, it's a mixture of things on the retail level, if you will, sort of one-to-one interactions, and then larger ones where you're talking to a policymaking group or legislators or that kind of thing. And so, my advice to people is start with what's easy for you to do. Start with something easy. And you may find that, a lot of people that I've talked to over the years, the very first thing they did was make a little display, for their kids' school. And then once they saw there was interest in that, they upped the grade, they're up their game. And then they were invited to do a presentation. And then pretty soon they were talking to the city council. And so it's just, find something that you can do and do it is my recommendation, and take part in Bonnie's stuff. I did the Fly-In in person in Washington, which was loads of fun. I did the virtual Fly-In last year. I'm going to sign up Bonnie to do it again. I mean, that's a great thing for anybody to do. But again, that's something that's easy for most people to do, because you can be sitting in your living room or wherever you have your computer and do that. And so start with the easy and work up to the harder.
Yeah, I think, Dorothy, you hit a lot of very key points to what is advocacy. And I want to bring it back to a very underlying, simple point as to, advocacy exists in order to evoke support. And evoking that support can come a variety of different ways, as you mentioned, as an individual level, you're convincing people that this is a problem that they need to focus on, and that it's something that they are, in threat of, versus on a governmental level, as Bonnie is doing with Center for Lyme Action, it's hoping to influence policy or funding changes, which obviously does overlap, but, it's just slightly two different ways of going about it. But again, really that underlying level of how do you evoke support. And some of the ways that you mentioned that I want to reiterate to say that Project Lyme also exists to do this is, for example, story sharing. Like, we recently put out a new set of public service announcements, which really focused on sharing the underlying story of individuals who went through misdiagnosis and issues with treatment, just like several other patients, throughout the community. And that in itself exists to, again, evoke support for patients. And you as an individual, if you're watching this and looking for ways to take that first step, sharing your story really can be a very powerful first step into working with advocacy. Now, I will say we didn't get a lot of time to go through all of these questions that I had here, and we actually have some really great ones open in the Q&A session. But what I want to go ahead and do first is move on to Michelle's presentation, let her walk through her roadmap real quick before we start answering any more questions, because I believe there's going to be some overlap. And to everybody who has put a question in the Q&A section, I see you. We will get to those after Michelle finishes up with her brief presentation. So thank you, everyone, for your participation so far, and I'll go ahead and turn it over to Michelle.
Hi, all right. Bear with me as I share my screen here. One moment, please. Thank you for your patience. Hitting presenter view. Okay, there we are. All right. So I just want to start by saying my presentation is not brief. It's very comprehensive, but we'll just roll with it and see what we can do. So I'm Michelle Tressler. I'm a co-founder of Massachusetts Lyme Coalition, and I am the author of the final version of the Lyme law in Massachusetts. I want to thank you first to Project Lyme and Noah Johnston for hosting this really timely event. It's great to be here presenting alongside stellar Lyme advocates and organizations, especially, I'm signed up for the Fly-In. Let's do this, Bonnie. And today I am offering my experience as a fellow Lyme survivor who felt called to advocate on the state level. I understand that there are many Lyme advocates and health policy wonks on the call today, or perhaps watching this later on. And I want to thank you for your advocacy and say I'm here today as one of you. While in the midst of my own health journey, I received an insurance denial of care. I decided then and there that no one should have to fight two battles at once, one for their lives and the other against insurers for access to physician-prescribed, potentially life-saving medication. So although I won my personal battle with insurers, I felt called to put my compassion into action for others facing similar situations. So first, I will seek to define the problem that we faced in Massachusetts and that many Lyme communities continue to experience across the US. And then I will interweave our experience in Massachusetts with the Lyme Advocacy Roadmap to Success. I will also touch on the importance of creating effective health policy and the benefits of offering inclusive social media campaigns. Now, before I dive in, I want to share that the most important ingredient for our success was our commitment, the strength of our will. If times get tough, remember the why of what you're doing and who it is for. So my fellow co-founder would joke, sometimes we were the walking wounded, and yet our strength and commitment never wavered. There's a quote by Steve Jobs, and I'll only use part of it, but he says, "People who are crazy enough to think they can change the world are the ones who do." So here's our Massachusetts Lyme Coalition, just the two of us, spearheading a movement of ready and willing Lyme warriors ready to heed calls to action. With Trish, I found someone just crazy enough to take on this David versus Goliath battle with me, to go up against the insurance industry, to go up against the governor, to go up against the Infectious Disease Society of America, all that power and money, to go against all the odds. Together, we helped co-create a movement, and together with the community, because the community is essential. We are simply members of the community. We changed the landscape for people with Lyme disease in Massachusetts. You know, people said we were crazy, and they weren't wrong, but we also won. So this is our story. To offer some background, at the time, Massachusetts was second in the nation for Lyme disease cases. In 2017 alone, 8,692 people tested positive for Lyme disease. And due to underreporting, the CDC acknowledges that it could be increased by a factor of 10. And the state epidemiologist agreed. So we're looking at roughly around 87,000 people contracting Lyme each year. And according to researchers, an estimated 63% of people experience chronic Lyme, or what some refer to as post-treatment Lyme disease syndrome. So we're looking at 54,810 new people each year in Massachusetts with chronic Lyme. If we were to look at those numbers through the conservative lens of the CDC, we're looking at 17,400 Massachusetts residents with new chronic Lyme each year. That's a lot of suffering, absenteeism at work, missed school, and missed opportunity. So yet, despite this clearly endemic disease, insurers were denying care after an arbitrary 28 days of antibiotic treatment. As a result, many people who were still sick had to pay out of pocket or go without medication. As we told the Massachusetts House and Senate, denial of coverage is denial of care. We are better than that. We care about our neighbors, our sons, our daughters, our mothers, and our fathers. Insurers were pushing costs onto citizens. As a community, we said enough is enough to insurers who were pushing expenses off to the residents, employers, and the state. So I know this issue with insurers firsthand, as I mentioned before. And together, we stressed to the legislators that it may just be another bill to them, but to us in the Lyme community, it's our lives. So the problem facing our community was quite dramatic. Before our law was passed, these stories were all too common. The situation in Massachusetts was heart-wrenching. The gaping holes in insurance coverage were placing people's lives on the line. So the main problem facing the Lyme community was clear for us. And the question we brought to our legislators was simple. Who do you want deciding your medical care, your doctor or your insurance company? So that brings me to our Lyme Advocacy Roadmap to Success. And here it is. It's deceptively simple, yet each step is critical. The process is cumulative, so that inattention to a previous step could jeopardize the potential effectiveness of the policy effort and make further steps more difficult. It's also an iterative process, so you'll be doing this along the way and circling back again and again. It's not necessarily linear. I'm going to loosely use our success in Massachusetts as a case study and weave this roadmap through so you can see that you can do this too. So, number one, identify the problems And number 2, identify policy issues, as you can read left to right up top. So it goes left to right all the way down. So identify problems and identify policy issues. Here we have just a sample of issues facing the Lyme community that can be addressed on the state level. As we all know, in Massachusetts, this is what was going on for us. Health insurers were not holding up their end of the bargain with consumers who pay to insure their health. So what's the solution? A patient protection bill. All right. Now, there are plenty of other potential policy issues as well, some that you may be facing in your state. And they include the following: doctors at risk of losing medical license due to Lyme treatment, a lack of prevention, education, or awareness efforts, and lack of adequate surveillance of prevalence of Lyme disease. So my suggestion is to identify the policy issues and potential solutions, and then figure out your priority list with the help of the community. It's important to listen to, involve, and work with the community to define your problem and your goal or solution. You don't need a health policy or health promotion background like I have to co-create community priority list. These are just a few of them here, as you can see. In Massachusetts, our initiative focused on protecting patients, enhancing community engagement, and increasing awareness and education. So define your problem, then define your solution. And as for strategies for success, each state is unique. There's different set of legislators and circumstances, but one thing that can be applied across the board, aside from legislation, is spearheading a multifaceted effort using direct outreach to engage with people affected by Lyme disease. Notably, we included support groups in this effort, and we simultaneously increased awareness in the legislature through many face-to-face meetings with our senators and representatives. We engaged the media by writing numerous editorials. We gave interviews, and we just kept trying to engage every way we could. We used technology to our benefit by engaging thousands of people on a weekly basis through Facebook alone. And we led Twitter and email campaigns, which encouraged grassroots outreach to the State House. Our social media strategies for engaging and informing the Lyme community proved critical in our ability to quickly mobilize the community to take immediate action. So this is something you want to make sure that you can do if you're thinking of doing anything similar. But before I get too far ahead of myself, let's go to the third stop along the roadmap for success. That is to identify the strengths of your community by assessing community readiness. In Massachusetts, there was already a proclamation education awareness of the month of May for Lyme and a doctor protection bill. Thanks to Trish with the proclamation, by the way, and her other group, SLAM, as well. And then you want to identify potential areas for improvement and find ways to reduce the burden of participation with people who have limited energy or mobility. So Bonnie's whole thing with this virtual Lyme Fly-In is genius. I think it's wonderful. And then also you can provide up-to-date scripts for phone calls and emails. Scripts are really important for people who might have brain fog or just not feel up to actually writing something themselves. And then use social media to your advantage. And again, I'll get to that later. So as you assess what has been done so far and evaluate the current conditions, just notice, have prior advocacy efforts worked? Why or why not? In our instance, the bill had been proposed for a while without getting passed, which was actually a good thing. As the way it was written, it would have harmed the community, not helped, if it had passed. If you're working with policy, it's good to start with evaluating any relevant policy that's been put forward to date, whether in your state or another one, which brings me to our bill. So for those policy wonks out there, this slide is for you. I don't have time to go into every detail today, but when I was rewriting the bill, it was crucial for me to look at other bills that contained potentially fatal flaws. As I alluded to earlier, components of this earlier proposed bill, if it had passed, would have harmed more than it helped with Lyme disease because it would have restricted access to care and made it more difficult for people to access their medications. Given my background, I was able to spot the problems, and I consulted with 2 former assistant district attorneys to make sure the new bill was as succinct and legally sound as possible. So why do details matter? Well, a similar law was passed in Minnesota, but then Blue Cross Blue Shield went to court over it and won and had the bill overturned. So things need to really be legally sound. Every word matters. And there was a really important change you might see up here, and versus or, okay? So if you look at what's highlighted in red, the patient's symptoms, diagnostic test results, or response to treatment, that said and. This is a problem because it could potentially be read to then require all three components that are listed. And as we all know, a lot, with the test results, they're very unreliable. So requiring positive test results to then have insurance treatment, that would exclude a lot of people. And so that is the potential harm. So just that one switch and or made all the difference. So, okay, going forward. Rhode Island was the first state, we're the second, but Rhode Island was the first state to pass a bill related to insurance. And 10 years had passed since the Rhode Island legislation. And so we had the opportunity to see what had worked and what could be approved upon in the next generation or iteration. And there were a few issues, like I said, that and issue again. So now that that is clear, that looking at policy is part of assessing community readiness, let's head back to our map. So what's next? Identifying key stakeholders, number 4. So it's so important to build allies and identify potential opponents. And it may not always be who you expect. We had some surprises along the way, but thankfully we had some stellar allies. So we had these legislative champions, and Ann Goby was really just absolutely stellar for us. Prior to meeting her, we had dealt with a legislator who prior advocates had worked with in earlier legislative sessions. Well, we found out he was meeting with insurance industry lobbyists 24 hours before our bill needed to move forward. Want to guess if it moved anywhere? So be selective and trust your gut. The story about how Trish found Ann Goby and met her is pretty impressive. It was before she was even elected to Senate. And so I drove the hour over to Sturbridge, Massachusetts, and met both Trish and Ann Goby. And she didn't flinch when we told her what we were up against. And to her credit, she decided that day to become a champion of the highly politically charged bill. And in doing so, she took a stand for citizens across Massachusetts. And as a freshman senator, she didn't back down when receiving pressure from insurance industry lobbyists or the Infectious Disease Society of America or the governor. She pledged her support, and actually in her winning acceptance speech, when she won Senate and during her time in office, she said, "This bill is my #1 priority." So find your Ann Goby. You want the real deal. And Representative Linsky was amazing as well. Okay, I can't underscore the importance of an engaged and empowered community enough. The bill passed because of the efforts of hundreds of Massachusetts residents speaking as one unified collective voice. When we'd find out that certain efforts were underway to block it, we'd send out an immediate call to action and we'd make the phones in the legislators' offices ring. Also, due to the sheer power of numbers, we were able to secure 140 co-sponsors for our bill. As you can see, in the 2009-2010 legislative session and the 2011-2012 legislative session, prior efforts were not going anywhere. It is essential to listen to and work with the community. As a result, we had a 7,000% increase in support for the bill, 7,000%. So 70% of Massachusetts legislators signed on as co-sponsors. And this would prove to be crucial when we face unexpected challenges down the road, in particular, the governor's veto. We needed 2/3 of legislators to override it. If they hadn't been co-sponsors at the beginning and heavily vested in this, we wouldn't have stood a chance. So just to give you a little bit of an idea, because I'm flying a little bit all over the place, I want you to see this timeline and that there was a lot going on. We were both active in the Lyme community before we created the Lyme Coalition in 2014. And as you could tell from the prior slides, that's when things really got rolling, when we secured all those co-sponsors when the community got really engaged. So we proactively guided the bill through committees. So bills can get stopped in committees and die there. So it's really important to push them through. So as you can see, they were pushed through and then sent to the governor. But let's not finish the timeline just yet. We're going to go back to the roadmap, because after all, how do we get 70% of Massachusetts legislators to sign on as co-sponsors? Community. Make sure you're able to directly communicate with the community and quickly, re-emphasizing it. We use technology to our benefit, again, and our social media strategies for engaging and informing the Lyme community were critical in our ability to quickly mobilize. One of our Twitter and Facebook campaigns, the Massachusetts Faces of Lyme, was an unexpectedly key component of the campaign to win the hearts and minds of our legislators. We started this campaign, which was based in part on a participatory photography strategy of citizens communicating concerns to policymakers, so legislators could see their constituents who would be directly affected by the passage of the Lyme legislation. We found it essential to appeal to our common shared humanity. Many legislators engaged with us on Twitter and also reached out to us via phone and email to say it made a significant impact on their own unwavering decision to support the bill, despite the many hurdles, and on their colleagues' decisions to stand by us as well. As many people were too ill to meet with their legislators in person, this tool was incredibly useful. It helped elevate traditionally marginalized voices and increase public participation in legislative advocacy. So we asked people affected by Lyme disease to send in photos of their faces and their zip code, so we could directly send each legislator photos of their constituents whose lives would be positively impacted by passage of the bill. We were essentially making an invisible illness visible. Twitter and Facebook provided that platform for us to connect citizens' faces and their Lyme battle with their specific legislators. We'd also tweet or post educational information, such as how many people in a particular legislator's district had Lyme, along with their constituents' faces again, so they could see who would actually be impacted by the passage of the bill. So the bottom line is, I strongly recommend implementing a participatory photography social media campaign because it engaged and empowered citizens, and it increased public participation in legislative advocacy. So we are at the last stop of the Lyme advocacy roadmap. Congratulations, you've hung in with me so far. Thank you. We have laid the necessary groundwork for success. The plan of action may include some or all of the points here. I want to talk a little bit about proactively guiding the bill through the legislative process. Trish and I, we worked on this on a near daily basis for hours at a time, keeping all of the co-sponsors informed of the latest updates and what they could do to help move it forward in a particular committee. And simultaneously, we kept the community apprised of any developments. This multifaceted effort included engaging the media by writing numerous editorials, giving interviews, and sending press releases throughout the process to keep the pressure on. Here are just some of the headlines. Another important part of advocacy efforts, of course, is to anticipate your opponent's tactics. But yeah, there's quite a few headlines. So our opponent's tactics, we knew they'd go after the cost of the bill. So it's important to learn to speak insurance lobbyist language, anticipate their arguments. Oh, it's too expensive. So I co-authored a report to the Center for Health and Information Analysis, which is a governmental agency in Massachusetts, which showed how it actually cost Massachusetts money not to pass the bill. So the Massachusetts Center for Health and Information Analysis, this is what you see here in front of you. Using available facts and figures, I sent a report explaining why it would result in little to no cost to the Massachusetts economy. And this was a huge hurdle to overcome because a lot of times bills are referred to this agency for them to die. Because if they find there's a big price tag or any price tag associated with the bill, legislators tend to vote it down. So it was an important part of the timeline of events for our bill, which is why I include it. And then also you see here, You can reframe the discussion too. You can talk about what the cost of not implementing the bill is as well. So the last month was a bit of a roller coaster. We were flying high when it was approved by the Senate and then the House. And then we had a humbling experience to have pushed for so hard for so long. And then to have the governor side with the Goliaths. He is a former, executive with the insurance of an insurance company. So we shouldn't have been too surprised. But so we kept the pressure on through editorials, the phones were ringing, the community was fully engaged. And importantly, every legislator knew it, which is why with 2 minutes left to go, at the end of the 2-year legislative session, even though the governor had vetoed it, our bill officially became law. So due to the passage of our bill, Massachusetts is now amongst a small group of states leading the nation in legislation that protects people who are affected by Lyme disease. We have made health insurers accountable for holding up their end of the bargain with consumers who pay to insure their health. And the story doesn't end there. Never underestimate the power of precedent. This was my dream, a state-by-state movement to protect people with Lyme. Our law has had a ripple effect across the nation as advocates realize that they can do this. So as I mentioned before in the Q&A about working on the state level to mandate insurance, it's really important to do state by state sometimes so we can garner support for action on the federal level. So does this actually work? Well, let's take a look at West Virginia. Thanks to the Pritchards, a couple, and an aptly named Governor Justice for signing the Lyme disease bill into law, what you see here is the ripple effect. We created and passed effective, sound legislation in Massachusetts, and advocates in other states took notice. They literally copied and pasted the essential part of our bill. Now, they took out the coverage for experimental drugs for Lyme, but that could have been due to the difficulty in trying to get that portion of our bill passed. If it works as is for your state, great. If not, and you want to use it as a template and build on it, that's great. If you want to use your own, that's great too. Just be mindful of the language. A senator in West Virginia was quite clear that he used our legislation as a guide as he spoke to the news. As you can see here, Illinois also used our legislation as a template. Interestingly, Illinois improved upon it, I think, by using tick-borne disease instead of just Lyme disease. And Illinois did not include an emergency preamble, which is basically a cherry on top, but hey, now it's law, it's okay. They had to just wait a few months. And now other states are following suit. So Maryland and Pennsylvania have both repeatedly put forward similar legislation to our bill, with success being just out of reach so far. But they are making progress because people with Lyme or loved ones with Lyme are coming together to put compassion into action. So, are efforts happening in your state? Find out. Perhaps you are the one that people are waiting for to spearhead change. If there's only one thing you take away from my presentation today, it is that your voice matters. Don't let anyone tell you otherwise. We were successful because the efforts of hundreds of Massachusetts residents speaking as one unified collective voice. So will you help lead advocacy efforts in your state? If you remember the slide of priorities from the beginning of the presentation, there are so many areas you can make an impact in when it comes to the Lyme disease. I look forward to reading about what you set out to do and hearing you present your story one day. Thank you for what you do. Your voice matters. Share your story. Thanks for your time today. I look forward to hearing of your success. Okay.
Awesome. Thank you so much, Michelle. And I definitely echo that last piece. Make sure to share your story. It's very important. We are running close on time for the evening. So I'm going to go ahead and open it up for our Q&A session. I'll ask Michelle, stop sharing your screen if possible.
Yep. Yes, I'm just going there now. My apologies. One second.
I turned it off.
Here we are. Okay, good.
So I will go ahead, and we have some great questions coming in from the audience. I will go ahead and start here, which I think really is a good follow-up as to what you were just speaking on, Michelle, because it's related to insurance. This question relates to alternative treatments for Lyme disease. We can apply this to everybody, not just Michelle, but is there any advocacy efforts currently going on specifically for alternative Lyme treatments, mainly because, as you may know, a lot of Lyme literate doctors have to work outside of insurance, and a lot of people cannot afford some of these therapies. So is there anything currently in motion related to that?
Well, our law covers it, a lot of it. I'm not going to say everything because it doesn't, but there's a really important part of the law, which I didn't get into the details because I was trying to be mindful of the time, but that says that experimental therapies related to Lyme that have been approved by the FDA, but they're being used off-label for Lyme, that they are covered. So that's a huge part of our bill, and we did it.
Yeah, that is very huge. And I guess one thing to take away, Susan, I believe, who was asked that question, is if you are going through this process yourself, ensure that the wording is similar to, as Michelle just mentioned, to make sure that it's covered outside of traditional therapies, because there's definitely a lot of people in the community who do go that route. I'll go ahead and follow this up and I don't know who might be best to answer this, but we have a question in from Kathleen. She was one of the pioneers in advocating on behalf of Lyme disease in upstate New York. And she had a question about how does Lyme advocacy and how can we take what we've learned from that and apply it to other syndromes associated with tick-borne disease, such as mast cell, chemical sensitivities, alpha-gal, which is the allergy associated with it. Any suggestions on how to wrap all of that into advocacy?
So, I'm happy to take this, and if anyone wants to jump in, but I think one of the important things that we're trying to do is instead of just saying Lyme, Lyme is such a hot button topic, to really change it to tick-borne diseases, because most people with Lyme disease just don't have one disease. They have multiple. My daughter has 5 co-infections along with her Lyme disease. So I'm being very mindful. I know other people are being very mindful of saying tick-borne diseases. And so, alpha-gal is getting a ton of press. And I will be honest, the patient advocates in the last go around of the tick-borne disease working group, they were hammering down every public comment time. There was someone talking about alpha-gal. And in the result of that, they brought one of the top alpha-gal advocates, Dr. Jennifer Platt, onto the big tick-borne disease working group. So again, it goes back to advocacy. I think mast cells becoming a bigger thing. I think there's Bartonella and Babesia, they're talking about that in the tick-borne disease working group. So I definitely think things are going. And I think if we could umbrella it under tick-borne diseases, maybe we'd have a better chance of getting it funded. But back to alpha-gal, those advocates, worked really hard at the last tick-borne disease working group, and they're now have somebody on the big group. So good on them.
Awesome. Yeah, I totally echo what you just mentioned, Holiday, and I would say Project Lyme tries to do the same when it comes to referring to all tick-borne diseases. If anybody follows us on social media, you'll see that we cover and share a variety of information related to all of the co-infections in addition to Lyme disease. So I totally echo what she's saying and think it's extremely important as a community to push that narrative. Michelle.
I just want to say that I absolutely agree. And the tide has really changed on that. So when we put forward our legislation and it was finally passed in 2016, we couldn't use tick-borne disease because not enough people actually knew what that meant. And also Lyme was defined already as a term in the Massachusetts state of law, because there's the doctor patient protection bill. So it's really important. But now if you can use tick-borne disease, absolutely. And whether it's mast cell, whether it's alpha gal, whatever it is, you can use that roadmap for success, those 6 key points, and apply it to anything.
Yeah, one question that we had here is, can we provide that list of steps? And Michelle, I was actually going to follow up with you regardless after this to say, can we take your presentation and include it with this video alongside our website resource, so that when we send this around to people, they not only have an opportunity to review what we've spoken about tonight, but to actually look at the presentation in a step-by-step capacity.
Yeah, absolutely. There's so much information on all those slides. And I think there's actually a lot of important information. And just because I knew we were already going over with Q&A and the prior presenters, I didn't want to, I tried to speed through a little bit.
Of course. Yeah, we've definitely been reiterating information throughout the evening, but in the most important way, in my opinion, mainly because we have so many different levels, as we described earlier. It's like there's individual, state, federal, but the strategies that you can use there can be applied across all the different levels. So I believe what we can go ahead and make our final question for the evening, just given time. And I think it wraps well as what we are doing as an organization, but there is here, could there possibly be a diagnostic test that is accurate? And while that doesn't necessarily apply directly to advocacy, I think that the concept of working towards developing a accurate diagnostic test is something that does flow well into some of the federal advocacy that Bonnie and Center for Lyme Action is doing. So I'll defer to you, Bonnie, and kind of take that question a step further and saying, what kind of funding or appropriations is there currently being pursued in relation to like a diagnostic test? Unmute.
We have this amazing program, which was funded by the Coens and HHS, which is a Lyme Moonshot diagnostic program. So that prize challenge is a great program that is kicking things off. There, we also have, in the federal government, the NIH has a department called NIAID. That's Dr. Fauci's department, and it's the infectious disease department. They have put together a fantastic strategy. It's their tick-borne disease strategy for the NIH. They just need to execute it. And one of the pillars of that is diagnostics. If you go through and look at all and I did this, you go through all the funding that's been funded by NIAID. It's largely about what's called pathogenesis, which means how does the bug work? They haven't gotten to diagnostics and therapies in NIAID, and we really want to encourage that activity. Please, NIH, please execute your own strategy. We really want you to do that. As everyone knows, the diagnostics are very problematic now. There's 2 approaches for diagnostic. One is how your body reacts to Lyme disease, and that's called the host response. So you're measuring that, and that's what our current serology tests are, and that it works, not so great. Works okay, not so great. And then there's a direct test where you're trying to find the bug or pieces of the bug inside your body. And so it's likely, and this is probably, I'm speaking from my own experience at studying this problem for about 10 years. It's likely that we're going to need multiple tests, both direct and indirect type tests, in order to actually fully diagnose a Lyme patient. And so we need a very significant investment in order to get there. Very significant investment. So if we don't have $500 million or $1 billion a year being spent on tick-borne disease, I'll be really unhappy. So we're on our way. We're at over 100 million. We need to get to $500 million to $1 billion a year for this thing in order to fix our problem, and we will.
Awesome. Yeah, very, very rousing. I'm glad that everybody seems to agree with that number, and hopefully, continue to push through that with Center for Lyme Action. And as mentioned throughout this evening, the underlying goal of this event, which in my opinion has gone great, we still have a lot of questions, but are really running out of time. So I want to reiterate to everybody that Project Lyme, Center for Lyme Action, Live Lyme Foundation, LymeDisease.org, Massachusetts Lyme Coalition, and Michelle will all continue to work and push for progress in the space of advocacy, and also work to continue to educate the community on how to get further involved, because continuing to gather and grow that support is the most important thing to achieving success, and obviously to having success in pushing for funding. Obviously, as Michelle has stated, you know, it will take time. So that's one thing that I want to, I think, finish up on, in saying that nothing's going to happen overnight. You know, I've been working with Project Lyme for 1.5 years, and there has been progress, but it was progress that has come out of years of work before I joined the organization, and with so many other organizations. And for years to come, we'll need to continue to work in order to achieve legitimate progress. So that's kind of where I want to leave everyone for this evening, and say that given the popularity of it, I would suggest I will work with the 4 of these ladies and see if they'd maybe consider a part 2 sometime down the road to dig even a little bit deeper than we were able to go tonight. But for now, thank you to all of our participants. Thank you to all of our panelists for joining us this evening, and really appreciate your insights and help for our community members. Thank you so much. All right, bye-bye.